button. Okay, so we have Alex here to present on radon awareness. And Alex, I will hand it off to you at this time.
Alrighty, let me get my presentation pulled up here. So you should be able to see my screen with my PowerPoint on it. So like Tracy said, we're going to talk about radon awareness. My name is Alex Writz, and I'm the Healthy Homes Program Coordinator for the Health Department. I work a lot with childhood lead poisoning prevention, and then also some other healthy homes aspects like radon. So Radon Awareness Month is here in January. A big part of that is when you test your home for radon, it needs to be closed up. So most of us don't have our windows open, for a nice January weather. So kind of convenient for that. So first thing I want to talk about is just kind of what is radon. And it's a naturally occurring radioactive gas. It forms when like uranium and different elements in the earth decay. And as they decay, instead of being more of a solid element, it becomes a gas. And of course, the gas is trying to get out of this enclosed rock space. And it causes lung cancer, and it's actually second only to smoking in terms of lung cancer. If you are a smoker, your risk goes up quite a bit if you are also exposed to radon. And then it is the leading cause of lung cancer among people who do not smoke. And I think it's also the leading environmental cause of cancer. So it's kind of a big deal. There's a big consequences to radon exposure. And the other thing about radon is that you can't see it, taste it, or smell it. There's no way for you to just be in your home and know if you have radon or not based on your own senses. And we want to be able to find out, if we have radon or not before it's too late and we do have that lung cancer. So as I mentioned, radon enters your home as it's trying to escape from the ground. So any cracks in the floor, joints, if there's like a sump pump or different service pipes coming in and around the home, even through water pipes, sometimes radon will rise up into your home. And when it's, just rising up through the grass outside, it disperses in the air. There's plenty of outside air, so it becomes a really low concentration. But when it tries to get into especially basements, it can rise to a much higher concentration and be kind of trapped inside there. And that's where it becomes really that concern. So like I said, you can't see it, taste it, or smell it. So unless you are testing for it, you will not know. So I think that's kind of the biggest, point we want to get across to people is that you can't know unless you're testing for it. And, we don't want people to find out they have lung cancer and then wonder about the causes of it. We want them to be able to take proactive actions on it. In Iowa, it's particularly important. 5 out of 7 homes in Iowa have high levels of radon. It's about 1 in 15 nationally versus the 5 out of 7 here. So it's a really big concern here in Iowa. Recommended level for radon before we start looking at mitigation systems and things like that is less than 4 picocuries per liter. Average in the US as a whole is 1.3, and average here in Iowa is 8.5. So we're over twice the recommended maximum amount of radon on average. So it's really important that we are, like I said, testing for it and being aware of it so we can take those actionable steps. This is a map from the EPA that just kind of shows us general areas about radon risk. Yellow is where they predict the lowest concentrations of radon. Radon is a risk across the entire United States, but the lower risk is in the yellow areas. Orange is starting to get a little more concerning. And then, of course, we can see here in Iowa, all of Iowa is in that zone 1, where the average reading is expected to be above that 4. So no matter where you are in Iowa, our geology that we have underneath all of Iowa here makes us more prone to the risk of radon. So testing for radon is pretty easy. It's $10 a kit for here at the health department. And with that kit, and there's a couple pictures on there, it comes flat. You fill out your information on it. You circle the day and time that you start it. It needs to sit for at least 3 to 7 days, no less than 3 days, no more than 7 for this particular kit. And then you circle the end date and time. And then the kit itself is actually able to be mailed directly to the lab. So one side has your information that you write on it. The other side is the prepaid postage and everything. So that $10 does include everything that you need. It's the kit. You don't have to pay for additional postage. You don't have to pay for additional lab fees or anything like that. Basically inside that kit, there's a cardboard piece that you fold and pop up like the top left picture, which helps hold it open to collect air. We set them up in the basement, usually the lowest living level of your house. Basements where its concentrations are usually highest. So that's a good place to test. And you want it kind of around breathing air height. So somewhere like 3 to 6 feet high. It could be sitting on top of a shelf. There's a little plastic hook on the side that you can hang it on a wall or something like that. And it needs to be placed away from drafts or vents. Like in my house, I have my staircase that leads to the basement. Directly across from the door at the top of those stairs is my outside door. So I don't want to put it anywhere near the bottom of my staircase where outside air is coming in and kind of rushing through. We want to find a spot where we're catching that kind of stagnant, stale air. After you mail it in, the results are available. Either they'll mail them or email them back to you, or on the top of your kit is a number that you can always use to go look up your results. And that's at radon.com. And then if your radon level is high, there are mitigation systems that can be installed. This is kind of a diagram showing an example of that. What it's trying to do is collect the radon gas from under your foundation so that instead of letting it force up into your home, there's basically a fan and a pipe that's going to collect that gas and then send it out through the roof of your house. So rather than concentrating in your house and rising to dangerous levels, being sent out through the roof, it's allowed to kind of dissipate within the air and not be as highly concentrated. If you are having one installed, or a credentialed radon mitigation specialist within Iowa, the Iowa Department of Public Health's website has that list of people who can install that and make sure that everything's getting sealed up and everything like that properly. And then whenever I talk about radon, I also like to mention the Waterloo Community Development Grant Program. It's the Lead Hazard Reduction Program, grant through HUD. For any homes that are in Waterloo, either renting or owned. If they're built prior to 1978, which is when lead paint was banned, and there's children under 6, either in the home or frequently visiting, people may qualify for this grant. And if they qualify, that means that we can come in and do a lead inspection, healthy homes assessment, which includes radon testing. So part of that healthy homes assessment involves setting up 2 different radon kits and including those in the results. And then if there's lead hazards that are found, there could be funding available to fix those lead hazards, and sometimes additional healthy homes funding to fix additional hazards on top of that. So their number is there, or you can apply online for the program too, is how they're doing that. Otherwise, for picking up a radon test kit, they're, like I said, $10 at the health department. I think some hardware stores and stuff have them too, but they're more like $20, $25 there. So we basically sell them, for pretty reasonable rate for radon test kits here. Anytime we're open Monday through Friday, 8 to 4:30, you can pick one up at the health department. We do have 2 more events that are coming up next week, though, for Radon Awareness Month. So we'll be at the Waterloo Library on Tuesday, January 24th from 9 to 11 in the morning. And on the 26th, next Thursday, from 4 to 6 that night, we'll be at the Cedar Valley Sportsplex, and we'll have radon test kits available at those events as well. So that's kind of a quick overview, I guess, of what radon is and kind of the steps that we're looking to have people take. Website and my our phone there is at the bottom. Any questions or anything like that on radon?
Okay. I have questions. I have comments.
All right.
Okay. So my first thing, didn't know that Iowa was like top dog for radon. That's, I feel probably not a solid bragging right, but it is what it is. This map though is really tripping me out a bit, because like it's so interesting, like with the Midwest and like the plains and what have you, like there's like, we're like super intense, and then you get out to like South Dakota and Nebraska and suddenly it's like lighter. My question for you, and I don't know if you know the answer, is does this have anything to do with the Black Hills that are out there that are like, as far as like the geography of it, like does that like affect things perhaps?
Yep. This map is really based on a lot of the geology and kind of the expectations for what the current geology is and how likely radon is, because it's that naturally occurring gas, and it occurs in all these places, but there's just higher concentrations of elements that can decay into it that they found within the red zone areas.
Interesting.
Yeah.
Okay. I feel like I want to like talk to those health departments out there with the yellow zones in Nebraska and see what they're doing with their lives.
Yeah.
See how that's going. Well, that's interesting. But yeah, so yeah, okay, so it has to do with the geology you're saying. Okay, that's really interesting. And then the kits are $10, so that's really awesome. Then there people can just walk into the health department and head up to 5th floor.
Yep.
Grab
Yep,
one,
they're
and it's that
from
easy.
the front
Okay.
desk there. Yep.
Okay, awesome.
And that's anytime all year round, not just for Radon Awareness Month. That's all year round. Like it said, Radon Awareness Month is in January because most of us don't have our windows open. So it's a good time to test when we're getting a good reading on that air, but they're available all year round for purchase.
Okay, awesome. And then the testing process is pretty simple. You just pop that thing open, set it downstairs for a couple days, and
yep. So
easy peasy.
Test kit like this that's flat, and then that piece of cardboard just gets bent open to hold it open. This one's been bent quite a bit, so it fights with me a little bit, so that it just stays open and collects air. Okay. And inside is like a little pouch that will collect that air and absorb it for the testing. Okay,
cool. Well, that seems easy peasy. I feel like I should probably do this, considering what my line of work, it's probably silly if I don't.
I know it's one of those things where I think it's, we know it's a risk maybe, but because the risk is cancer, it's not an immediate risk like carbon monoxide or, something in our homes like that. Sometimes it's one of those things that's easier to push off because it's a future problem potentially.
Sure. Okay.